name is Alyssa Lang, and I am giving my speech on the importance of prenatal and postnatal care. How many people know much about prenatal care? How many people have gone through pregnancies before? Well, I'm here to tell you why it is all important, no matter if it's your first or your fifth pregnancy. I have worked in an OBGYN office for about 5 years now, and I've experienced pregnancy myself. There's a lot that goes into prenatal and postnatal care, but it is probably the most important thing that a mom could do not only for herself, but for her soon-to-be new baby. I'm going to be going over what prenatal care consists of, why I believe it's necessary, and the importance of a postnatal care visit as well. First, I want to go over the basics of what a provider recommends during prenatal care, starting with the number of visits. Your first visit will happen between 8 to 12 weeks gestation. After that, you'll be seen every 4 weeks until 28 weeks gestation. From 28 to 36 weeks, you'll be seen every 2 weeks. Then 36 weeks until you deliver. Around 41 weeks, you will be seen every 1 week. Now, this might seem like a lot of doctor's appointments, but I promise there's something specific that happens at each one. At each visit, your doctor is looking at your blood pressure, your weight, checking your urine for any infections, listening to baby's heart tones, and measuring the size of your uterus. There's also blood labs and ultrasounds to be done that are for a specific purpose. Blood labs are routine to check on mom, make sure that there's no issues such as gestational diabetes, anemia, STDs, things that need treatment. There's also genetic blood tests that can check as early as 10 weeks to see if there might be a risk of any genetic abnormalities. And bonus, we'll tell gender early on if you'd like to know that. The anatomy ultrasound happens around 20 weeks, and that checks baby from head to toe. Make sure everything looks good, no abnormalities, checks the amniotic fluid level, placenta, and much more. You might also have additional ultrasounds depending on what your doctor feels necessary for the health of your baby. Now, it might not sound like a lot of these visits are necessary. Well, let me tell you a quick story. At my 20-week ultrasound, I went in and everything looked great. I can show you. Kept these for my little one, and from the surface everything does look good. The next day we got a call from our doctor saying that everything did look good, but there was one concern. My baby had what's called a 2-vessel cord instead of a 3-vessel cord, which can cause growth restrictions. It means that she's not getting enough nutrients, oxygen, blood from the placenta to her to help her to grow how she needs to. So with that, we had additional ultrasounds throughout the pregnancy to make sure she was growing on schedule. As a mom hearing this, I was very worried, very nervous. It's a situation that's out of my control, but by having those prenatal care visits and trusting my doctor, I knew that everything was going to go well because she was doing well at every one of her appointments. Now I want to go into some other reasons why I think prenatal care is important. Some of the biggest concerns providers look for in pregnancy are things such as hypertension, gestational diabetes, placenta previa, and preeclampsia. Most of these, if left untreated, can cause serious damage to mom or baby in utero and possibly result in death. For example, if gestational diabetes is left untreated, you have a higher risk of having a stillborn or a premature baby, and mom is more likely to develop diabetes later on in life. At each one of these prenatal visits, your provider looks for how your weight is doing, how your blood pressure is doing, make sure there's no infections, so they can give you the best care possible. By having these lab tests and ultrasounds done, doctors are checking to make sure not only baby is good, but mom is good as well. According to Kim Teston, MD, she states, babies and mothers who do not get prenatal care are 3 times more likely to have a low birth weight and have birth complications. By having these regular checkup visits, the provider can measure baby, look at how baby's doing and how mom is doing, and if they have to intervene and give you other care, they definitely will. Did you know that moms can have a fetal demise or stillborn baby at any point of the pregnancy, and that's anywhere from when they got pregnant up into 40 weeks gestation? According to ACOG, early pregnancy loss is common, occurring in 10% of all clinically recognized pregnancies. Approximately 80% of all cases of pregnancy loss occur within the first trimester. The CDC also states stillbirth affects about 1 in 160 births, which is referring to any mom who is between 20 to 40 weeks gestation. By coming to all your prenatal visits, your provider finds a problem. Sometimes there's a fixable solution and they can intervene. It doesn't always end well, that is a sad reality, but your care team is there to help you through the hard times as well. Now that you've gone through what seems to be the hardest part, don't forget that one visit that happens after you have your baby. Your postnatal care visit that happens between 4 to 6 weeks after your baby comes. Doctors are looking for how you're doing mentally, how you're doing physically, how you're bonding with baby, and much more. There's a lot of change that happens, and you might not know what you're doing, and it's nice to have that talk with your doctor to make sure everything is going well. Currently, as many as 40% of women who have given birth do not attend a postpartum visit, according to ACOG. It might seem very hard to get out of the house with a newborn, but trust me, it is probably the most important visit that you can have, because we want to make sure that you're doing well so that you know that you're doing well for your baby. Most people don't even think about this, but one of the concerns providers want to address at that visit is postpartum depression. According to American Psychological Association, up to 1 in 7 women experience postpartum depression. No matter how little it is, how severe it is, your provider wants to go over that with you and make sure that you're doing well. That way, if you need treatment, they can give you the treatment and care that you need to help that. So in conclusion, it might sound overwhelming at first, but all those prenatal care visits are important. Having prenatal care can bring out any issues or concerns that need to be addressed by your provider, and every pregnancy is different. Just as the prenatal visits are important, don't forget about that postpartum appointment as well. Do what you can to keep you and your baby from being one of the negative statistics. Just a little bit of care can go a long way for you and your newborn. Thank you for listening, and I hope you have a good day.